Dr. Fisher, what are these crazy contraptions and what do they do?
Yeah, good question. We've kind of leaned into it. They do look a little medieval, but effectively what especially we see with the dental roll table and then with the universal traction, what we're working to do is to restore normal spinal alignment. Now, an easy one to think about with the universal traction setup is that we'll have patients come in with a kyphosis in their neck, and that's where it's actually flipped the wrong way. Now, what the universal traction, by having a patient placed here, and then this going on the back of their neck, and then with this device going on the neck and back of the head there, what that does is through ligament restructuring, it actually works to stretch that back into place and to get it to set into place. There's these properties of ligaments called creep, hysteresis, and set that we've got to apply tension over a certain amount of time and then leave it in that position. It works up to about 10 minutes to take all the creep out, and then we need to set it into place for 10 to 20 minutes so that we're effectively really just restructuring those ligaments to make this a long-term change. Now, in other videos, I've talked about how patients like, well, why, I stretch or I exercise and get a massage and, the muscles in my neck will feel great for a little bit, but then they just come right back. With this, that's what we're working to do to correct that. Because if your head is leaned forward like this, your muscles in your neck are of course going to be tight because they're holding on for dear life. What this does is to work on the underlying spinal anatomy to really correct that and restructure it back into place. Now, with this, we obviously have patients doing home care as well so that they continue going on. We're not so naive to think people aren't going to be on their cell phones, but we want to make sure that we at least get this set up so that then we're just keeping you at that good level. And the research shows that as long as patients continue to progress through here or progress through what they're doing with their home care and don't go into a crash or something terrible like that, we actually have pretty good long-term results on making sure that things stay where they're supposed to be. So yes, while they do look a little intense, we've had a number of patients, especially on the UTS, that have fallen asleep in traction because as we take that stress off the spinal cord, they actually relax. It takes them out of a fight or flight. First time that happened and I heard somebody snoring, I about jumped out of my shoes. It's just not something you expect to hear at 3 p.m. in a chiropractic office and people running all around. But yeah, really what we're doing with this is working to restore normal spinal alignment to make the corrections we do in this office a long-term fix.
Yeah, awesome. Thanks.
Thank you.